Today I'm going to be performing a wound dressing change and irrigating the wound, as well as taking a culture off to the lab. Before I enter the patient's room, I want to make sure that I check their chart and also have all the necessary equipment gathered before I enter. So I'm going to knock on the door, perform hand hygiene. Hi Susie, how are you feeling today? Okay, so I'm going to be your nurse today. My name is Julia, and then all I'm going to be doing is changing your wound dressing, irrigating it, and sending that culture off to the lab. Before I begin, I'm just going to see your ID badge, and would you please state your name and your date of birth? Perfect. And then how is your pain level today? 0 being no pain at all, 10 being the worst pain you've ever felt. 0? All right. And then last time somebody came in to do this for you, did you have any pain medication at all? All right, perfect. So I'm just going to move this bed up really quick to ensure that I'm not straining my back and I'm working at a proper level. I'm going to lower this side railing, and then I'm going to pull this curtain to ensure your privacy. And then if it's okay with you, I'm just going to have to move this blanket down and move your gown up in order to assess the wound. All right, thank you so much, Susie. I want to ensure as much privacy as possible when I'm doing this to make sure Susie is comfortable the entire process. All right, once I have a good visual of the wound, I'm going to put down my drape to help with any excess fluids and to make sure that the bed doesn't get dirty or wet. And I can put my basin down for when I irrigate. And then I'm gonna perform hand hygiene again and put on clean gloves. You still doing okay, Susie? All right. So I'm gonna take this old dressing off for you, and to ensure that it's not painful, I'm gonna use the push-pull method going with the hair growth. And if that tape seems like it's sticking, I can just use an alcohol wipe in order to make sure the tape comes off easily. I'm gonna start from the corner over here. Get this side. All right. And then once I have this off, I'm gonna assess for the drainage by color, amount, and odor. Throw that away. Take out these old gauze. And now that I have the wound exposed, I can get a good look at it. I'm gonna check for temperature, swelling, inflammation, and just to make sure that it's not infected or anything. So after I've done that, I'm gonna take off my now dirty gloves. I'm gonna perform hand hygiene, and then I can begin to set up my sterile field. The first thing that I will wanna do is put down my drape. I wanna make sure that I'm staying 6 inches above. And as I'm opening this drape, I wanna use the 1-inch border because the inside of this is sterile and I wanna keep it that way. All right, so I'm just gonna lay out everything that I need in order to complete this. My container and my saline aren't gonna be in my sterile field, but I'm just gonna set it next to everything in order to make sure it's all organized. So I have my ABD pad. My gauze. Move this a little bit closer so I can get a better visual. I want the sterile field to stay in my field of vision. And I have my syringe, my Q-tips, and a little bit more gauze as well. All right. My culture. So now that I have my sterile field set up, I'm going to open up my saline container. The inside of this is sterile, so I will put the cap face down, pour in my saline, and then I can begin to put on my sterile gloves. I'm gonna perform hand hygiene one more time. I wanna be careful when I'm opening this to only touch the outside border. Now that I have my gloves on, I want to ensure that they stay above my waist, and then I can begin to take measurements of the wound. So I'll take one of my Q-tips, throw this away as well, and then I want to measure for the width. I have a ruler over here, so that's about 2 inches. I want to measure for the length. That is about 4 inches, and the depth as well. And as I'm checking for the depth, I want to ensure that I don't see any tunneling, and you look good, Susie. So after that, I can dispose of this Q-tip and I can begin irrigating the wound. So I'll take my syringe, fill it up with our saline solution, and then as I'm irrigating, I want to ensure that I'm 1 inch above the wound, going from the inside to the outside or from the top to the bottom. And I want to do this until it runs clear. You still doing okay, Susie? All right, we are almost done. So now that it's running clear, I can throw away my syringe, and then I can begin to use my spray. So now that I'm going to be touching the spray, this hand is no longer sterile. All good. I can take my basin away as well. And since this hand is still sterile, I can use my gauze to dry it. I want to dry it the same way that I irrigated it, starting from the clean to the dirty, the inside to the outside. All right. Now that that is all dry, I'm going to take off my dirty sterile gloves, perform hand hygiene, and then put on new sterile gloves. Since I have new sterile gloves now, I can begin to put new gauze into the wound. But before that, I want to also do the culture. So I will take my cap off, grab my Q-tip. And when I'm doing this, I want to make sure I'm not touching any necrotic tissue. And I want to do this for about 5 seconds, just rotating it. All right. And when I'm putting it inside the culture tube, I want to make sure not to touch the outside of it. Can put my cap back on. And then I can set it over here, and I will send that to the lab later. And then I can begin to put new gauze inside the wound. So I'll take my clean gauze over here. I will soak it in my saline, but I don't want it to be soaking wet. I just want it to be moist. And I'll take another one of my Q-tips to help guide it. I want to make sure I have control over it, so I'm going to make sure my hand is at the bottom. And I don't want to touch any outside skin as well. All right. Once that is secured in there, I can begin to put on the ABD pad. I want to ensure that the blue line is facing out. And I'm going to frame it as well, making sure that it's secure and no outside air is escaping or getting to it, I mean. Now that that is secure, I can go ahead and take off my gloves. And then I'm going to take my Sharpie and write the date, my initials, and the time. And I'm going to write that on the culture as well for whenever I take that to the lab. And I'm gonna clean up my area really quick. Was that okay for you, Susie? Are you in any pain after that? Still feeling okay? All right. I'm gonna put your gown back down for you. You're not too hot, are you? Is the blanket on okay? Perfect. I'm gonna put up my side railing, put the bed back down to its lowest length. Ensure that your call light is here. And then do you need anything before I leave? Got your phone next to you, water next to you and everything. Put this curtain back for you. And you just use that call light whenever you need me, all right, Susie? All right, thank you so much.